We all know about the importance of maintaining a healthy diet, right? It helps boost your energy, supports weight loss, it helps protect you from many diseases. Well, one type of diet that Cone health providers say can be beneficial is a plant-based diet. A Caswell County woman knows about the diet all too well. Wanda experienced high cholesterol and knew that she needed to change her eating habits. She switched to a plant-based diet in 2022 after facing a diabetes diagnosis. She says the switch to eating healthy happened gradually.
It was difficult at first because it was changing my habit. I'm a busy person, so I was eating on the run a lot. I was eating a lot of convenience foods, hitting a drive-through, that sort of thing. So I had to change my habits to start doing more meal prep and more planning for when I would eat, where I would eat.
Hammock says she began to eat more salads and beans by eliminating the fast foods and the processed foods. Because of her diet, her health improved and she's much happier, and she even lost 70 pounds in just over a year.
My lab work is phenomenal at this point. When I started this, my triglycerides were 139, which is in the normal range. My last blood work a couple of weeks ago, they were 53. So, I mean, it's just phenomenal. The changes, my A1C that was at 6.4, sitting on a diabetes diagnosis, are now 5.5 and are consistently held there.
Dr. Gebre Nida, a diabeticologist with Cone Health, works with more than 200 patients benefiting from the diet. He says 93% of the people in the world are medically unhealthy, and that the top 5 medical conditions, including diabetes, benefit from a whole food plant-based diet.
Keep food simple, get it from the ground, from the farmer as much as possible, instead of from the factories. So fruits and vegetables should be a staple every day, 4 to 5 servings. And then the next major staple should be start with beans, so, any kind of beans, and a grain.
So Dr. Nida says the diet can help your body fight inflammation, giving you a much better medical advantage. So that's why he's joining us today to talk about how you can change your diet. All right, so let's kind of talk about this. Is there a specific person who's like the whole food plant-based eating is recommended, or is this for just anyone?
Tanya, thank you for the question. I cannot think of anyone who would not benefit from a whole food plant-based diet. It is a part of a broader approach by American College of Lifestyle Medicine, focusing on preventive medicine, among other measures such as regular exercise, stress management, avoiding risky substances and social connections. Whole food plant-based diet to be the most important contributor for those efforts in achieving health and longevity.
The most. Okay, so let's talk about this. What does a whole food plant-based eating look like? Does that mean like you don't eat meat, you don't eat dairy? What does it mean? What does it look like?
The first thing to keep in mind is to keep it simple. It's not complicated. Whole food plant-based diet means food as close to its natural form as possible, meaning minimal processing or unprocessing, and mostly plants. For example, apple is a whole food, apple pie is not. Beef is a whole food, hot dog or sausage is not. So whole food plant-based diet is a slightly different category from what we are familiar with. However, it's a very, very studied, and evidence shows that this is superior diet pattern, where it is fiber-filled, it's anti-inflammatory, and it helps to prevent, treat, and reverse some chronic conditions associated with obesity and overweight.
Okay, and so I think that is key. It's not just plant-based, but it's also whole foods, since you mentioned that. All right, so let's kind of break it down even a little bit more. What should people decrease from their diet?
So the top suspects for disease-promoting foods include red meat, processed meats, refined grains, fatty meal, and full-fat dairy should be avoided by any cost.
Full-fat dairy is what you said, yes?
Correct.
Okay,
Correct.
So then what should people increase or have more of? So now they're thinking to themselves, okay, that's stuff that I'm not supposed to have as much, so how do we fill our plates?
Yeah, there is a broad consensus on these items who are encouraged by almost all dietary guidelines globally. People should eat more fruits and vegetables, whole grains, any nuts and seeds, low-fat dairy, and any fish and seafood are proven to promote health. So they should be encouraged.
Okay, how do we do this? So some people, would say do this little bit by little bit, transition. Some people say you need to go cold turkey and just like change everything all at once. What is your recommendation?
The recommendation is always slow, start slow and progress slowly. That way, the outcomes can be measured and individuals can decide which sweet spot to keep. For example, it's a spectrum from unhealthy foods towards the healthier options. And then you start somewhere. I think that's the most important thing, is finding out where you are. And then from that point, you move slowly towards whole food plant-based diet. And if you identify a sweet spot where you are happy with your outcomes, you keep it. If not, you keep moving towards the other end of the spectrum, which is whole food plant-based diet. But the change has to be slow, too small to fail. Otherwise, this is a lifestyle medicine. It's not a 3 months or 4 months commercial diet program. It's a lifestyle change, and it has to be a slow process.
So there are certainly folks out there who are wanting to make the transition. What are some simple steps that you recommend to get people started?
Okay, so first thing is our snacking options. I want people to snack with fruits and nuts as much as possible instead of crackers and cookies, for example. The other thing is start with something very basic like beans from a large variety of beans, and couple that with a whole grain. It could be rye or whole wheat or brown rice. And then always fruits and vegetables should be a regular staple for people. So I want people to add things that they may like before they take off things that they should at the end.
That's a good way. Add something you do like before you're taking things away. Okay, so maybe what examples of eat this instead of that you recommend to patients when they're making this switch?
Baked potato instead of mashed potatoes. That's one thing. I always get mocked by kids, my kids, when we go to a restaurant. I always ask for baked potato instead of mashed potato. It's not always available, but that would be one recommendation. The other thing is, simple steamed vegetables instead of French fries, for example, as a side. That's important. And then to snack, always make ready these dried grains, nuts available, so that you reach for that instead of processed carbohydrates such as crackers.
Gotcha. Hence, the baked potato is in its whole state versus the mashed potato, which has been mixed with a whole bunch of other things. I see. Okay.
Correct.
So this time of year, there are lots of fruits and veggies available, which is great. What are some easy ways, though, that we can increase summer fruits and vegetables in our daily planning to achieve more of a whole food plant-based diet, although throughout the year?
Yeah, that's a very interesting question. When I first came to the U.S., somebody took me to a grocery store and I saw lots of tomatoes, and I thought, oh, it must have been a tomato season. But turns out we are blessed in the US that we have everything every season, because we are getting things from everywhere. So my recommendation is when seasonal options are available, consume that, use that to your advantage. And when there is a surplus, then chop, pack, and freeze is an option for later use. So there is really no reason to waste or overuse available items. We can always pack, chop, and freeze for later use.
Okay. And when it comes to eating out, because that's definitely something that is difficult to do, to make those kinds of choices, what should people look for on the menu?
Okay, so when you eat out, do not compromise on your major dietary routines. For example, you still need to have a representation of your major macronutrients like carb source, protein choice, and vegetables. And then, like I said earlier, choose unprocessed carbohydrate choices, and then be mindful of bad unhealthy fats. For example, trans fats or saturated fats should be avoided. If you have to use fat, it has to be monounsaturated fats like oil would be preferred. The other thing is portion size. In the US, we have problem. You can always share it with a loved one. That's what I have been doing, for example, because we tend to have large portions, too many or too much calories to consume at one setting. Either take half home or share it with family members. So the point is, do not compromise your major routine dietary habits. just because you eat out.
Okay, we have just about 45 seconds. Tell me what a common pitfall or mistake is when we go grocery shopping.
Okay, so sugar is our problem, and sugar has 75 different names, and most of them are unfamiliar or unidentifiable for an average person. The best thing to protect yourself is from avoiding sugar altogether. And that is usually the trick where people are shopping. They don't know what's in the pack. So I recommend to avoid processed food.
Gotcha. Okay, the sugar for sure. Thank you so much for your time and your expertise. We appreciate it. All of this information is going to be in the To Your Wellbeing section of our website.